Welcome, curious minds, to another deep dive.
Great to be here.
Today, we're plunging into a really critical issue. It kind of quietly impacts dairy and beef cattle worldwide.
Bovine milk fever.
That's the one, scientifically known as hypocalcemia.
hmm
And this isn't just some, clinical term. It's a profound metabolic challenge.
Absolutely.
And as we'll discover, it really hits farm profitability and animal welfare hard.
Both. Definitely both.
So our mission in this deep dive is to, well, unmask this condition. We've sifted through a whole stack of sources.
Research papers, farm guys.
Exactly, the whole lot. And we're here to pull out the most important nuggets of knowledge, those surprising insights.
Give you that shortcut.
Yeah, give you that shortcut to being truly well-informed about this, well, often underestimated foe.
And we'll make sure this deep dive gives you a really comprehensive understanding. We'll get into the complex mechanisms behind it.
How it actually works.
Right. And its widespread impact, which is often hidden,
Yeah.
Plus the latest strategies, prevention, treatment.
All based on the material.
All drawn directly from the material we've looked at, yeah.
Okay, let's unpack this then. At its core, milk fever is fundamentally about calcium.
Abnormally low levels in the blood.
Right. And it mainly hits cattle right around calving time.
That parturient period.
And here's the first kind of surprising twist. That name, milk fever.
Total misnomer.
Complete misnomer. Because the affected animals, they generally don't have a fever, no high temperature.
Right. It's almost the opposite problem, temperature-wise, often.
Imagine looking for a fever and missing the real issue.
Exactly.
Oh.
And it's really vital to distinguish between the two main forms.
Okay.
First, you've got clinical hypocalcemia. That's what most people probably picture when they hear milk fever.
Like how that goes down?
Precisely. Severe, obvious symptoms. The cow being unable to stand, we call that recumbency.
Right.
Plus general weakness, they seem kind of dull or obtunded.
Okay.
And their blood calcium typically crashes below 5.5 milli-GDL. Most common within, say, 72 hours of calving.
Got it. So that's the obvious one. What's the other?
Then there's subclinical hypocalcemia, SCH.
Subclinical.
Yeah, and here you won't see those obvious outward signs. The cow looks, well, mostly okay.
But she isn't.
No. Her blood calcium is still too low, below about 2.0 millimole, or roughly 8.0 milli-GDL.
Ah.
And what's really eye-opening here, despite being asymptomatic, SCH is a massive concern.
Why is that?
Because it quietly compromises her physiological functions. It acts like a hidden gateway to a whole cascade of other health problems.
Like the domino effect starting silently.
Exactly. Continuously undermining herd health, profitability, often without anyone even realizing it's happening. It's the silent saboteur.
Wow. And the numbers, they really drive that home, don't they?
They do.
When you look at prevalence, clinical milk fever, the obvious kind, it's maybe 0 to 10% out in the field.
Though it can be higher.
Oh yeah, it can surge past 25% in some herds, and I saw even 80% in specific research trials, which is staggering.
It is. But compare that to subclinical.
Right, the subclinical form is just way more common, affecting up to 75% of dairy herds in the UK.
That's one figure, yeah. And around 43% of cows in other studies, it's widespread.
And it mostly hits the older cows, the multi-paresis ones.
Almost exclusively, up to 50% of them in some cases. It's pretty rare in heifers, those first lactation animals.
So, bottom line, if you're managing a herd, chances are pretty high you've got cows with this subclinical issue, even if they look fine on the surface.
That's the reality, and that silent nature translates directly to a significant economic hit.
Let's talk about the cost.
Okay, so clinical cases alone, the estimates are around £200 per cow in the UK, maybe up to $334 US per case.
And that covers meds, vet visits.
Meds, vet services, and crucially, the lost milk production. That's a big chunk.
But the subclinical costs, they're maybe even worse.
Arguably much greater, yeah, just because it's so widespread and the consequences are indirect but add up. Estimates for SCH, they range from around 70 US per affected cow. Some analyses show extra costs of about €54 compared to healthy cows. Older Canadian studies put it between $78 and $203 per subclinical case.
So it adds up across a herd.
Massively. Collectively, hypocalcemia, both kinds, leads to less milk, obviously, but also poorer reproductive efficiency.
How so?
You see longer times to get pregnant, longer calving intervals, more AI attempts needed,
Okay.
and higher culling rates. Cows just don't stay in the herd as long.
Right.
One study figured a single case might cost like $102 up front for the vet and labor.
Okay.
But then another $161 in future losses from higher culling risk, fertility problems, and lost production down the line.
Wow.
And it just makes cows way more susceptible to a whole laundry list of other expensive problems.
Like what?
Ketosis, mastitis, metritis, displaced abomasum, dystocia, difficult calving retained placenta. It's like it opens the floodgates.
It really is a domino effect.
It truly is.
And beyond the spreadsheets, beyond the economics, there are major animal welfare implications here too.
Huge. Absolutely.
Directly, the clinical form causes severe muscle weakness, right? Cows go down, they're depressed.
And it can progress to coma, even death, if it's not treated promptly.
And indirectly, this is maybe even more profound, it weakens the immune system.
Profoundly weakens it, making the cow incredibly vulnerable to painful, debilitating secondary conditions.
Like mastitis. That's utter infection.
Right. Metritis, which is a uterine infection. Dystocia, that difficult calving we mentioned. Lameness, too.
So it just makes them susceptible to suffering in other ways.
Exactly. And long-term, it tragically cuts down her productive lifespan by about 3 years, some estimates say.
3 years.
And significantly increases the risk she'll be culled prematurely.
And it even affects the calf.
It does. Maternal hypocalcemia impacts the offspring. They might not get enough colostrum or get it too late.
Which means their immunity is compromised.
Right. Compromised passive immunity.
Yeah.
Makes them more vulnerable to diseases early in life. It really is a whole system problem.
It affects everyone.
Yeah. And what's fascinating, or maybe sobering here, is that this widespread nature of hypocalcemia, especially the subclinical form, it really highlights that effective prevention and management aren't just about the farm's bottom line. They're fundamental ethical responsibilities in livestock production.
A welfare issue, plain and simple.
A significant and often underestimated animal welfare challenge.
Oh.
It really deserves our full attention.
So let's step into the science a bit. Pull back the curtain on why this period around calving is so tricky for cows.
Okay.
The parturient period, late pregnancy to early lactation, it's just incredibly demanding metabolically.
Hugely demanding.
Think about it. There's this abrupt, massive increase in calcium demand right when lactation starts, especially for colostrum, that first milk.
That colostrum is packed with calcium.
Exactly. Daily calcium excretion can just surge from maybe 10 grams during the dry period to like 30 grams per day.
That's a 400% increase.
A 400% jump. It's like asking a factory to suddenly quadruple its output overnight.
And the cow's body has mechanisms to try and cope with that surge. Normal calcium regulation relies on this critical interplay of hormones.
Hormones are key.
Definitely. Think of parathyroid hormone, PTH. It's like the body's alarm bell for low calcium.
Okay.
Calcium drops, PTH gets secreted. And it immediately tells the bones, release some calcium.
Mobilize the reserves.
Right. And tells the kidneys, hold on to calcium, don't let it go in the urine, and also activate vitamin D3.
Ah, vitamin D's involved too.
Crucial. Vitamin D3, once it's activated, which PTH helps with, it's like the crew that builds the bridges for calcium absorption from the gut.
Okay. Helps pull it in from the feed.
Enhances absorption, exactly. And also helps move calcium out of the bone reserves.
So PTH and vitamin D work together.
They do. And what's also fascinating, there's emerging research showing the mammary gland itself kind of acts like an accessory parathyroid gland.
The udder itself. How?
It produces something called parathyroid hormone-related protein, PTHRP, which also stimulates bone to release calcium, basically telling the bones, hey, send more calcium this way for milk.
Wow.
And even serotonin seems to play a role, stimulating this PTHRP and calcium movement into the mammary gland. It's complex.
It sounds incredibly sophisticated.
Yes.
But despite all these mechanisms, here's the rub, right? The critical challenge.
The time lag.
A time lag. Explain that.
Even with these sophisticated systems, it takes about 24 to 48 hours for the cow's whole homeostatic system to fully ramp up and mobilize enough calcium to meet that sudden, massive demand.
Almost 2 days.
Yeah, a day or two for everything to really kick into high gear.
And that delay, coupled with that huge calcium drain into the colostrum and milk.
Creates a distinct vulnerability window.
Ah, okay.
That window is precisely why cows are so prone to hypocalcemia around calving. It's like a race against the clock that their bodies sometimes just can't win fast enough.
So it's not just a simple deficiency then?
Not at all. It's more like a complex adaptive failure. The cow's physiological system's failing to adapt quickly enough to an acute metabolic challenge.
The factory just can't ramp up production on demand, essentially.
That's a good way to put it.
Which brings us to the causes. What actually tips a cow into this state? So what does this all mean for what causes milk fever?
Well, it's multifactorial, almost always.
Not just one thing.
Rarely just one thing. It's influenced by the cow's own characteristics, intrinsic factors, and also the environment and management around her extrinsic factors.
Okay. So what are some key risk factors?
Top of the list is probably age and parity. Older cows are significantly more susceptible.
How much more?
The risk goes up by about 9% per lactation, and it really jumps dramatically after the third lactation.
Why is that?
Well, as cows age, their milk production generally increases, putting more demand on calcium. But at the same time, their ability to pull calcium from their bones declines a bit,
Ah,
and their gut becomes slightly less efficient at absorbing dietary calcium. So higher demand, lower supply capability.
makes sense. What about breed?
Greed predisposition is definitely a thing. Jervy cows, for instance, are about 2.25 times more likely to get milk fever than Holsteins.
Interesting. Why?
The exact reasons aren't fully known, but it might be due to differences in, like, vitamin D receptors in their intestines, or maybe just differences in their incredibly high milk production relative to their body size.
Okay. And body condition. Fat cows.
Yes, body condition score, BCS, is vital. Cows that are too fat a BCS over 4 on that 5-point scale are like a ticking time bomb.
How much higher risk?
Over 3 times higher risk. 3.3 times, the data suggests.
Wow. Why are fat cows more prone?
It's often linked to them eating less reduced dry matter intake as they get close to calving, and that can impair magnesium absorption.
Which we'll come back to. Magnesium's important.
Critically important. And then, of course, there are dietary imbalances of key minerals in that pre-calving dry period diet.
Right.
Paradoxically, high calcium intake before calving, say over 50 grams a day during the dry period, can actually desensitize the cow's calcium regulatory system.
Makes it lazy.
Essentially, yeah, it makes the system lazy, less prepared to ramp up when the demand hits.
Okay. What else in the diet?
Also, high potassium intake. This often comes from forages grown on heavily fertilized ground, maybe over 2% potassium.
What does high potassium do?
It can cause metabolic alkalosis, which makes it harder for the cow to mobilize calcium from her bones and can impair absorption too.
Okay. Potassium is a tricky one. Phosphorus.
Too much phosphorus, maybe over 0.35% of dry matter, can interfere with the conversion of vitamin D into its active form.
Which you need for calcium absorption.
Exactly. And critically, magnesium deficiency. Even just moderate hypomagnesemia, slightly low magnesium,
Yeah.
profoundly impairs PTH release and how well the tissues respond to PTH. It critically compromises calcium metabolism. Magnesium is truly the unsung hero, or maybe the crucial linchpin here.
Got it. Magnesium is key. Anything else?
And finally, don't underestimate stress. The whole calving process itself is stressful.
Sure.
That stress triggers hormones that can further depress blood calcium levels.
It's clear these factors are all tangled up, isn't it? Like a complex web.
Absolutely interconnected.
You mentioned, for example, overconditioning leads to eating less, which causes magnesium deficiency, which then messes up calcium regulation.
Exactly. It really highlights how one problem can just cascade into another.
So it's not just one mineral we need to focus on.
No. And that really brings us to the fascinating interplay of calcium, phosphorus, and magnesium.
Okay.
Milk fever often involves drops in both blood calcium and inorganic phosphorus. One study found a combined deficiency in 43% of cases.
Right.
And as we said, high phosphorus can inhibit active vitamin D3.
And magnesium.
Magnesium is absolutely critical for PTH release, for vitamin D3 activation. If magnesium is deficient, calcium metabolism is directly compromised.
And high potassium messes with magnesium.
High dietary potassium impairs magnesium absorption. So you see how it links. High K-bill, low MEG with poor K regulation.
Wow.
This all feeds into the dietary cation-anin difference, or DCAP.
DCAD, right.
Yeah.
Heard of that.
Diets high in positive ions, cations like potassium, sodium cause metabolic alkalosis that raises blood pH.
Which isn't good for calcium.
No, it impairs calcium mobilization from bone.
Okay. So the real aha here is it's not just about calcium.
Not at all. It's this delicate, interconnected dance of calcium, phosphorus, and magnesium. One misstep throws the whole system off.
So milk fever is really a sign of systemic metabolic dysregulation.
Precisely. Which emphasizes that getting those mineral profiles meticulously balanced in the dry cow diet is paramount. It's not just about simple calcium restriction anymore.
Given all that complexity, accurate and timely diagnosis must be absolutely crucial for intervening effectively.
Critical.
So how do we spot it? What are the signs?
You're looking for clear clinical signs and stages of milk fever. The general symptoms are pretty obvious if it's severe:
Hmm.
inability to stand, dull appearance, poor appetite, cold ears, and muzzle.
Right, the down cow.
But there are stages. Stage 1, the mild or early stage, is often subtle, easy to miss.
What does that look like?
Cows are still standing, but they might seem hypersensitive, maybe a bit excitable. Fine muscle tremors, restlessness, maybe mild staggering or ataxia, ear twitching, head bobbing, shifting weight, shuffling hind feet.
Subtle signs.
Very subtle. But the key here is early detection. Catching it in stage 1 is so important to stop it getting worse.
So it's like catching those tiny behavioral changes before they become obvious physical problems. That
Yeah.
must be incredibly challenging in a busy barn.
It truly is. It requires really close observation. Then you get to stage 2, the moderate stage.
Right.
Here, cows are paretic. They can't stand, but they usually stay upright on their chest, in sternal recumbency.
Right, not flat out.
Not flat out yet. They appear dull, obtunded off their feed, dry muzzle, maybe a subnormal body temperature, cold extremities. Heart rate is usually rapid, over 100 beats per minute, but the heart sounds might be quieter.
Digestive system slows down too.
Yeah, gut stasis. So you might see bloat, no manure production. Cows often tuck their heads around into their flanks, sometimes get that classic S-shaped neck curve.
How long does stage 2 last?
Can be anywhere from 1 to 12 hours. Then stage 3. This is the most critical.
The severe stage.
Yeah, progressive loss of consciousness, heading towards coma. Now the cow is lying flat on her side, lateral recumbency. Muscles are extremely limp, flaccid, unresponsive.
That sounds bad.
Very bad. Severe bloat is common. Heart rate might be around 120, but the pulse in the extremities can be hard or impossible to find. If it's not treated urgently, stage 3 is often fatal within hours.
Okay, so those are the clinical signs. What about actual diagnostic methods beyond observation?
Blood tests are key for confirmation and for subclinical detection.
Right.
Ionized calcium, Acotig, is the gold standard, the most direct measure of the biologically active calcium.
Can you test that on Harmo?
Yes. There are portable handheld meters now that give results in seconds. Really useful. Normal is around 1.05, 1.30 millimillimole.
Yeah.
Hypocalcemia is usually defined as 0.9 millimolars less. Needs careful sample handling, though.
Okay, what about regular calcium tests?
Total calcium is less precise because it includes calcium down to proteins, which isn't immediately available. But it's still useful, especially for looking at herd-level issues. The cut point for parturient hypocalcemia is generally under 8.0 milli-GDL, maybe even 7.5.
Any other blood markers?
We also look at non-esterified fatty acids,
Mm-hmm.
NEFA. Elevated levels, especially in pre-fresh cows, indicate negative energy balance, which is often linked.
And ketones?
Yep, beta-hydroxybutyric acid, BHB, that's the key indicator for subclinical ketosis, another related metabolic issue.
Okay. And you mentioned checking urine.
Yes, on-farm urine pH monitoring. This is mainly used to see if a negative GCAT diet is working effectively.
What's the target range?
Target is usually between 5.8 and 6.8. It shows the diet is inducing that mild metabolic acidosis we want.
But it takes time to show up.
Yeah, it might take about 48 hours for the urine pH to fully reflect a diet change. So it's a monitoring tool, not an instant diagnostic for the cow's calcium status right now.
Gotcha. Are there newer things coming? Emerging tech?
Definitely. Some really exciting developments, things like attomolar-sensitive 3D printed sensors.
Wow, sounds fancy. What do they do?
They're being developed to detect the ratio of ionized calcium to phosphate directly in a milk sample.
In milk. That's convenient.
Potentially very convenient. Could give early indications of problems, maybe even before blood levels drop significantly. Promises rapid on-site testing, like 10 seconds, and low cost. Still under development, but promising.
Very cool. Anything else?
There's also a fascinating new theoretical framework called the calci-inflammatory network theory.
Calci-inflammatory. Okay.
It proposes that milk fever isn't just a calcium deficiency. It might be part of a more complex inflammatory response around calving.
Inflammation.
Yeah, the idea is that inflammatory signals might actually precede the calcium drop, maybe by weeks. Up to 11 weeks, some models suggest.
Whoa. That changes things.
It could potentially change how we think about prediction and maybe even prevention, focusing on inflammation earlier. Still a theory, but very interesting.
So these advancements, it raises an important question, doesn't it?
Which is,
How are these things shifting management? Are we moving away from just treating down cows?
exactly, the shift is definitely towards proactive intervention, especially for those subclinical cases. These tools could enable much more tailored, effective prevention strategies. We're moving from, firefighting clinical cases to actually preventing the fire from starting.
Okay, that perfectly tees up prevention then, which, as you said, is really the cornerstone of proactive herd health. Avoids the immediate costs, avoids that whole cascading domino effect.
Absolutely. Prevention is where the biggest gains are.
And nutritional management is king here, right?
Paramount. Absolutely number one. Traditionally, the approach was often low calcium diets pre-calving.
Restrict calcium before they need it.
Yeah, limit intake to less than, say, 20 to 50 grams per day. The idea was to prime the PTH system, get it ready to mobilize calcium when needed.
Does that work?
It can, but it's challenging to implement consistently.
Hmm.
Forages naturally contain calcium, so getting levels low enough is hard. And sometimes those low calcium diets aren't very palatable, so cows don't eat enough, which causes other problems.
Right. I heard an old saying, no milk fevers, no milk, like you might compromise production.
That's the potential trade-off if it's not managed perfectly, yeah. Which is why the dietary cation-anion difference, DCAD diets, became more popular.
The DCAD approach, more sophisticated.
Much more sophisticated. It's about achieving a very precise negative balance between cations and anions in the diet.
Like fine-tuning a chemical recipe.
Exactly. You increase anions like chloride and sulfur relative to patients like potassium and sodium. This induces a mild, controlled metabolic acidosis.
And that helps calcium.
Yes. It gently lowers blood pH, which makes the bone and kidney tissues more responsive to PTH. So the cow is better able to release calcium from bone and absorb it from the gut when that massive demand hits.
How effective is DCAD?
Highly effective when done right. It can virtually eliminate clinical milk fever and significantly cuts down on other transition diseases too.
What are the challenges?
It requires very precise forage analysis. Wet chemistry is usually recommended over NIR for the minerals. And getting the formulation right is key. Palatability of the anionic salts can sometimes be an issue, so they need to be mixed well into a total mixed ration, TMR.
And you need to monitor it.
Absolutely. That urine pH monitoring we talked about, aiming for 5.8 to 6.8, is crucial to confirm the diet is actually achieving the target level of acidosis.
Okay, so DCAD is a major tool. What about supplementing other minerals?
Yes, magnesium, phosphorus, and vitamin D supplementation are part of a holistic approach.
Yeah.
We keep coming back to magnesium.
Because it's critical.
Critical. Minimum 0.4% magnesium in the dry matter, essential for PTH release and vitamin D activation.
And watch the phosphorus.
Don't let phosphorus get too high over 0.35% dry matter, as it can inhibit active vitamin D3.
And vitamin D itself.
Vitamin D3 supplementation can be used maybe 5,000 to 10,000 IU per day for the last 3 to 8 days before calving. It can enhance calcium absorption and mobilization. But,
There's a but.
yeah, careful dosing and timing are crucial. Too much for too long can cause toxicity, or paradoxically even increase milk fever risk in some situations. It's not a silver bullet.
Okay. Any new feed additives showing promise?
There's research on novel feed additives like zeolite A. It's a sodium aluminum silicate.
How does that work?
It binds dietary phosphorus in the gut. Lowering phosphorus absorption seems to trigger bone mobilization and increases blood calcium. Preliminary research looks promising, didn't seem to hurt milk production. Still early days, though.
Interesting approach. Okay, moving beyond diet, what about just general dry cow management practices?
Hugely important, often overlooked but critical. Maintaining that ideal body condition score, BCS 3.0 to 3.25, at dry-off and calving.
Not too fat, not too thin.
Exactly. Remember, those over-conditioned cows, BCS over 4, 3.3 times higher risk.
Right. What about their housing?
Housing and environment matter a lot. Clean, dry, comfortable resting spaces, well-bedded free stalls, or bedded pack space. Crucially, avoid overcrowding.
How much space?
Ensure adequate feed bunk space, maybe 36 inches per cow, and resting space, at least 1 free stall per cow, or about 100 cells feet of bedded pack per cow. Overcrowding causes stress, reduces intake.
And ventilation? Heat stress.
Good ventilation is key. And heat stress mitigation fans, sprinklers, is really important during hot weather, even for dry cows. Heat stress messes up everything.
And just general stress.
Critically important to minimize stress. Reduce pen moves. Ideally, cows stay in the same group through the dry period. If moves are unavoidable, move multiple cows together weekly, not individuals, and practice quiet, gentle handling.
So it's not just about cow comfort, it actually impacts their metabolism.
Directly impacts feed intake and immune function. Stress hormones interfere with everything. So, yes, good dry cow management isn't just a welfare thing, it's integral to metabolic disease prevention. It sets the stage for healthy transition.
Makes sense. And looking really long-term, what about breeding? Genetic selection.
That's the sustainable long-game strategy. Genetic factors definitely influence health traits, including susceptibility to metabolic diseases.
Can we actually select for better calcium regulation?
We're getting there. Genomic advancements have revolutionized dairy breeding. We can select for production, sure, but also for health traits, fertility, immune function, even heat stress tolerance now.
So we can breed cows that are naturally more resilient.
Exactly. This proactive generational approach complements the immediate management and nutritional interventions. It leads to a herd that's just inherently less susceptible to these challenges over time.
Okay, so prevention is key. But what if, despite best efforts, a cow does get milk fever? How is it treated?
Right. Treatment definitely depends on the severity. You approach it differently based on the stage.
So for that clinical milk fever, the down cow, stage 2 or 3,
The standard of care, the immediate fix, is intravenous calcium administration.
the calcium drip.
Pretty much. Usually something like 500 milliliter of a 23% calcium gluconate solution. Important to warm it to body temperature first.
And give it slowly.
Very important. Administer it slowly, usually over about 5, maybe 10 minutes. Giving it too fast is dangerous.
Why?
Risk of cardiac arrest. Calcium directly affects heart muscle contraction. Too much, too fast can stop the heart.
Okay. Slow 5E calcium. How quickly does it work?
The response is usually quite rapid if it's straightforward milk fever. About 75% of cows will try to stand up within 2 hours. You'll often see signs like her heart rate slowing down, pulse getting stronger, maybe some muscle trembling as the calcium kicks in.
But you mentioned a risk of relapse.
Yes, that's a key insight. Even after successful 5E treatment, blood calcium can drop again, often around 4 hours later.
So the IV fix is temporary.
It's a temporary boost. And interestingly, giving larger IV doses doesn't seem to prevent this post-dosing drop. The body just clears the excess or it gets used up quickly.
Which is why follow-up oral therapies are essential, right?
Absolutely essential to prevent relapse. Once the cow is recovered enough that she can swallow safely,
Key point, she has to be able to swallow.
crucial, then you give an oral calcium bolus or drench, and typically a second dose about 12 hours later.
What kind of oral calcium is best?
Products that combine different forms are good, like calcium chloride, which is absorbed very quickly, maybe with calcium sulfate for a more sustained release.
What about calcium carbonate, like limestone?
Generally too slowly absorbed to be effective for this acute phase treatment. You need something faster acting.
Okay, so that's for the clinical down cows. What about treatment or management for subclinical hypocalcemia, the standing high-risk cows?
For those cows, oral calcium boluses are the primary intervention. Again, usually one dose right after calving and a second dose 12 hours later.
Who should get this prophylactic oral calcium?
It's particularly beneficial for those known high-risk groups.
Mm.
Older cows, second lactation, and greater cows that are lame going into calving high-producing cows.
Does it make a difference?
Studies show measurable benefits. One showed cows getting oral calcium gave about 6.8 pounds more milk at their first milk test date compared to controls.
But you said routine diagnosis of subclinical is hard.
It is.
So does that mean prophylactic treatment for these high-risk groups is often the way to go?
Precisely. Because it's so hard to spot every subclinical case, targeting those identified high-risk groups with preventative oral calcium becomes a really practical and effective strategy for many farms.
Makes sense. Now, for those cows that do go down, even with treatment, sometimes they stay down, what about supportive care for these downer cows?
That's absolutely vital and often determines the ultimate outcome. General principles are meticulous nursing and good environmental management to prevent secondary problems.
Like what kind of secondary problem?
Muscle damage, nerve damage from the pressure of lying down, pressure sores, dehydration, aspiration pneumonia if they can't swallow properly, mastitis from lying in muck.
So keeping them down is risky in itself.
Very risky. The prognosis definitely gets worse the longer a cow is recumbent, even if the initial milk fever is treated. Time is critical.
What does supportive care involve?
If they're dehydrated, fluid therapy.
Yeah.
Maybe IV fluids like dextrose and saline. Hypertonic bicarbonate might be used if they have metabolic acidosis. Always provide easy access to clean, fresh water.
Nutrition.
Offer good quality feed where they can easily reach it. If they're unwilling or unable to nurse their calf or eat, tube feeding with milk replacer or electrolytes might be needed.
And the nursing care itself.
Move them to a soft, clean, dry area. Deep straw or sand bedding is ideal.
Keep them clean and dry.
Essential. And turn them from one side to the other regularly, maybe every 6 hours, to prevent pressure damage.
Help them stand.
Assist them to stand periodically, maybe every 6 hours, using devices like hip hoists or slings, but very carefully to avoid injury.
Milking. pain relief.
Regularly milk out the udder to prevent mastitis and relieve pressure. And consider using nonsteroidal anti-inflammatory drugs, NSAIDs, for pain and inflammation, which can definitely help their comfort and willingness to try standing. It's intensive care, really.
It sounds like a huge commitment.
It is. These detailed supportive care protocols really underscore that managing milk fever, especially down cows, goes way beyond just giving calcium. It's about preventing those secondary complications to maximize chances of recovery and, frankly, for welfare reasons. It's a holistic approach to getting her back on her feet and healthy. And, if we connect this back to the bigger picture, milk fever is rarely just an isolated incident, is it?
No, you mentioned it's often intertwined with other problems.
Frequently intertwined with a whole complex network of other parturient diseases, it really acts as a predisposing factor. It kind of opens the door.
It makes them vulnerable.
Exactly. Exacerbating the incidence and severity of other costly conditions. Just think about reproductive diseases alone. The collective economic burden is estimated around $1 billion a year in the U.S.
$1 billion. Wow. It's like milk fever is the ringleader sometimes.
In a way, yeah. It weakens the cow, disrupts her system, and makes her an easy target.
So what are some of these other troublemakers that milk fever often invites to the party? You mentioned dystocia, difficult birth.
Right. If a cow has low calcium, her muscles are weaker. That includes the uterine muscles needed for pushing.
So uterine inertia.
Exactly. Uterine inertia is often linked to hypocalcemia. That makes a difficult birth more likely.
And dystocia itself causes problems.
Oh, absolutely. Physical trauma for the cow, which increases her risk of uterine diseases later, like retained fetal membranes, metritis. It drastically reduces her fertility, impacts milk production. And for the calf, it's terrible. Much higher risk of being born dead or dying soon after. Reduced vigor, slower to nurse, compromised immunity. It's bad all around.
Okay, so dystocia is one link. What about mastitis? Udder infection.
Another major connection.
Yeah.
A cow struggling with low calcium, as we said, has a weakened immune system.
Right, the immune suppression.
That makes her an easy target for mastitis-causing bacteria, whether they're contagious ones spread during milking or environmental bugs lurking in the bedding.
And mastitis is hugely expensive.
The most costly disease on most dairy farms, mainly due to lost milk production, but also treatment costs, discarded milk, extra labor, potential culling. Milk fever just ramps up the risk.
Okay. And you also mentioned reproductive infertility. How does milk fever tie in there?
Well, again, it throws the whole body out of whack metabolically and hormonally. Calcium, phosphorus, energy balance, they're all crucial for proper reproductive function, for cycling, for ovulation, for maintaining pregnancy.
So the imbalances from milk fever mess that up.
They can definitely contribute to problems like delayed return to cycling, cystic ovaries, poorer conception rates, leads to longer times to get pregnant, more services per conception, which costs farms significantly.
Makes sense. It disrupts the whole system.
It really does.
And finally, you mentioned it can even impact the calves directly through things like umbilical infections or navel ill.
Yes. Think about it. If the dam is stressed, maybe he has hypocalcemia, maybe he had a difficult birth.
The calf might not get colostrum quickly enough.
Exactly. Inadequate colostrum intake, or failure of passive transfer, FPT, leaves the calf with poor immunity. At the same time, the umbilical stump is basically an open doorway for environmental bacteria.
Especially in a dirty environment.
Especially in damp, dirty calving areas. So bacteria like E. coli, staph, Truparella pyogenes can easily invade, causing local infection onphilitis or spreading internally.
Where can it spread?
Up the umbilical vein to the liver, up the urachus to the bladder, or even systemically into the bloodstream, causing septicemia, which can lead to joint infections, joint ill, pneumonia, meningitis. Serious stuff.
Wow, so a rough start for the dam can directly lead to serious infection in the calf.
Absolutely. And this really highlights that strong causal link between, say, calving pen hygiene, colostrum management, and naval care, and the calf's health and survival. It's a direct line from farm sanitation and early calf care to calf vitality and, ultimately, farm profitability.
So, wrapping this deep dive up, it's crystal clear, isn't it? Milk fever isn't just this one standalone condition.
Not at all.
It often acts as this central metabolic disruption. It predisposes cows to that whole cascade of other costly periparturient diseases we just discussed.
The interconnectedness is undeniable. They all feed into each other.
And tackling one, especially preventing milk fever, often helps prevent the others down the line.
Which really necessitates a fundamental shift in thinking towards an integrated herd health management system.
A holistic approach.
A truly holistic approach, building a resilient herd. And that relies on those pillars we talked about. Nutritional precision, especially things like DCAD,
Right.
stringent biosecurity and hygiene, comprehensive vaccination programs, smart, judicious genetic selection, and just vigilant monitoring.
It's about building that resilience from the ground up, not just reacting when things go wrong.
Exactly. Proactive, not reactive.
And here's where it gets really interesting again. Looking forward at those exciting advancements in research and diagnostic tech,
Yeah, there's a lot happening.
we're seeing things like omics technologies, that calcine-inflammatory network theory is an example. Genomic selection revolutionizing breeding.
Those rapid on-farm diagnostics we mentioned, the portable ICO meters, maybe those 3D printed milk sensors down the road.
Precision livestock farming sensors, monitoring cows in real time, advanced reproductive diagnostics, even innovative non-antibiotic treatments are being explored.
The pace of change is pretty incredible.
Which leads us to a final thought for you, the listener, to mull over.
Given all this complexity, the interconnectedness of these diseases, and this rapid pace of technological advancement, how might these precision livestock farming tools fundamentally transform the role of the individual farmer?
From being perhaps a reactive manager dealing with sick cows?
To becoming more of a proactive health strategist in the next decade,
Hmm.
using data, using insights to prevent problems before they even start.
And what new skills will be most critical for success in that evolving landscape? Something to think about.
Definitely something to think about.
Well, thank you for joining us on this deep dive into the complexities of bovine milk fever.
It's been a fascinating discussion.
We hope you continue exploring these fascinating and truly vital topics in animal health and production.